Hi, everyone, and welcome to the Muslim Sex Podcast. I have some exciting news. I want to let all of you know that I am opening up my office, my private office, where I can see you here in New York, and it will be opening at the end of this month. So this month is now June. So at the end of this month, my office will be up and running, and I would love for you to come in and see me as a patient. So go to V Health, so that is FEMMEVIEHEALTH.com, and sign up to be a member of my concierge gynecology practice. And you can also come to see me for regular visits, or if you have a problem visit, come and see me. I, of course, focus on menopause and sexual health. So if you're having any of those issues, I'd love to see you. And make sure you come in and say hi. I'd love to meet you in person. So also, the retreat is still going on. It'll be happening September 16th through the 23rd, and we only have a few spots left. So if you were thinking about coming to the retreat where we focus on nutrition and sexual health and menopausal health, you need to register today because spots are filling up. And once it's sold out, it will be sold out and we will not be taking any more participants. So make sure you go and register for that as well. Also, as always, please remember to like and share this podcast. Leave me a 5-star review so that it shows up and so that we can get the word out about menopausal and sexual health, as well as intimacy and intimacy coaching. So if you love this podcast, please make sure to leave me a 5-star review. And now on to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about changes in your skin and physical appearance as you go through the different stages of life. So even if it's puberty for your children or your daughters, and then as you go perhaps through pregnancy and even into perimenopause and menopause, we have with us today board certified dermatologist. But before we get into it, the one thing I want to make very clear, as I do always, is we're definitely not giving any type of medical advice. If you have any questions about your skin or aging or any of those things, please speak with your friendly neighborhood healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So here today, I'm so happy to have on with me Dr. Mary Alice Mina. And Dr. Mina, if you could please introduce yourself to our audience and listeners, that would be great.
Hi. Well, thank you so much for having me. And I'm really excited to be here. And I can't wait for our discussion today. So yeah, I'm a board certified dermatologist and dermatologic surgeon. I practice in Atlanta, Georgia, and I do a lot of procedural dermatology. But as I've gotten older, and I think especially with the pandemic and with the rise in social media and people getting their information there, I've really realized that I need to have a louder voice beyond just my clinic walls. And so I started a podcast called The Skin Reel, and am just trying to give people in this very busy, noisy skincare, skin health space some real factual information about their skin health and aging and what's hype, what's not, what to believe, what not to. And so it's just been a lot of fun, and I'm hopefully can impart some knowledge to your listeners as well.
All right. Awesome. Well, I'm really excited to have you on. And this is definitely a topic that affects everyone and something that I definitely have not covered yet. So I'm excited to have you on. And I know a lot of people that listen, maybe in the perimenopause, menopausal stages, but then those women may have daughters that are going through puberty and may notice some skin changes during puberty. So maybe you could talk to us just a little bit about that.
Yeah, so our skin, we frequently say it's the largest organ out there, and our skin is constantly changing, and I think people don't realize that. And acne, things like acne, people think, oh, shouldn't that just be a teenage thing? Why am I still struggling with it? And I'm 40, right? But our hormones, especially as women, they're always in flux. And then you hit perimenopause and then menopause. And as your listeners know, and you have that dramatic drop in your estrogen. And so our skin is impacted by that. And our skin is very sensitive to hormonal changes. And most women listening would probably say, oh, yeah, my skin, I do notice my skin does change with menstruation and things like that. But I think that that's one thing people are surprised about, that their skin isn't, it's not like you make it through your teenage years and then your skin's going to be great and clear and you're going to have no problems. It's just you can get acne at any age, really, from neonatal acne to being older, more mature, and you can also get other skin changes that happen. So I think people just think of acne as a teenage problem, but it's not. Now, I know for me personally, I had acne. I don't know if you struggled with acne when you were a teenager, but
Oh,
I can
yeah.
really empathize with that. I tend to have oily skin. People who tend to have oily skin tend to get acne. People who have more eczema prone skin, what we call atopic dermatitis, they tend to not get acne when they're younger, but they can also, get it later in life. So yeah, as we're hitting puberty, right, and we're having an increase in androgens, that's when we can see acne coming out. But we can also see it later in life as our estrogen drops, and then we have a higher relative amount of testosterone. And so that's why you might see it flare when you're in your 30s, 40s, and 50s.
That's so good to know. Yeah. I mean, I think that a lot of times, women tend to think that we don't have testosterone, but of course, we know as practitioners, we definitely have testosterone. And a lot of times, when there's an imbalance in testosterone, you'll see a lot of the testosterone effects, right? And you, of course, as a
Yeah.
dermatologist, know this, but just as speaking as a like another physician, a lot of times we'll see the acne. We can't even see like the male pattern baldness, depending on how high that testosterone is. We can have like deepening of the voice and all these other changes. But specifically in relation to having a higher level of testosterone, definitely a lot of hair
Yeah.
that forms on our body, and also a lot of acne as well.
Well, I'm glad you brought up hair too, right? Because I
Yeah.
used to think hair loss was just something men had to worry about and that it didn't affect women. And now I'm realizing, like, no, that's so wrong. And in fact, I think in some ways, it is more emotionally damaging for women because we associate hair with beauty, femininity, and you do notice, I would say pretty much every woman is going to notice thinning of their hair. Now, if you start out with as you age and hit perimenopause and menopause, if you start out with really thick hair in the beginning, then you're lucky. It's not going to be as noticeable, but you'll notice it, right? But if you start out with thinner hair, then it is more noticeable. And so we do see that hair thinning. We call it, male pattern baldness, but we also can see female pattern baldness, which is, again, that relative higher amount of testosterone compared to estrogen. And we also don't fully understand how estrogen helps keep our hair from falling out. But that's definitely an area of research that people are looking at, because when our estrogen levels are higher, it's usually not an issue. And then the other thing is you lose the hair on your head and then you grow hair where you don't want to grow hair, right?
Yeah, no kidding,
But
right?
hirsutism, and women who are in menopause listening probably are like, oh yeah, that dark chin hair that just won't quit or go away, and you keep having to pluck it. So that can happen as well. And that can be really distressing for women, right? Who are thinking, oh my gosh, like, why am I growing a beard? Why am I growing hair on my chin? So yeah, it's funny. It's like, why can't I grow it on my head and not my chin? But that's testosterone at play.
That is crazy. I'm so glad you bring up hair loss, because I think so many women, have that. And, when you go to your dermatologist, all they can tell you is, oh, it must be stress. No, everyone has the
Yeah.
same amount of stress. Like, everyone has tons of stress. I don't think there's anyone that I know that doesn't have stress. But, like, what are the other causes? And I was talking to some other people, and they said, like iron deficiency, B12, definitely getting your hormones checked. Perhaps you have a lot of
Yeah.
testosterone. So, and some people even recommend maybe even going on spironolactone.
Yeah.
which blocks the androgen receptors, right? And
Yep.
so is it so you're blocking now we have to go back to biochemistry and see how that works. So you're basically blocking, is it the 5 alpha reductase that you're blocking? You're blocking the androgen receptors. Where exactly is spironolactone acting?
Okay, yeah, you're making me go way back. But spironolactone is actually it's a diuretic, and it's an
Right.
anti-aldosterone receptor, and it blocks the aldosterone receptor, which affects like salt and water intake. And so you may notice a little more urination, but it does also affect your androgen receptors at the hair follicle. And so
Mhm.
you're thinking of like finasteride and dutasteride, that are those 5
Okay.
alpha reductase inhibitors. So
Yeah.
spironolactone is a great medication. I love it for women who are probably 30s beyond. And we call it hormonal acne, even though really all acne is hormonal, because it can help with acne, and it can also help if you are getting those dark chin hairs, things like that. It's not. It may be in a younger woman. I might use it for losing hair thinning on the scalp, but it wouldn't be necessarily my first go to for that. I think minoxidil is more of my go-to, but it can work great, especially if someone has signs of hirsutism, the hairs, maybe more of a concern for PCOS, things like that. Then spironolactone is a great medication.
Interesting. So you're saying that, and minoxidil, just for those people that are not familiar with that, I know there are a lot of men that use minoxidil. So minoxidil is a pill that you would take, and how does that work?
So minoxidil is actually a blood pressure medication. So it causes
Mm,
vasodilation. So it widens your blood vessels, which is why it was used to help lower blood pressure. But what people realize, which is kind of the funny thing about a lot of these medications we use, right? We use it for one thing, and then we notice, oh, you also grew long eyelashes, or you also can't frown anymore. So it now has been, they discovered that actually it can help people grow their hair. And we don't fully understand how it works with the hair follicles, but we presume it's by increasing blood flow to the hair follicle bulb and helping promote the anagen phase of your hair follicle cycle. So there are 3 stages. The anagen phase of your hair cycle is when the hair is growing, and you want to keep it
right.
in that longer. So we don't fully know the mechanism with hair loss and how it helps grow, but the thought is that the vasodilation increases blood flow and oxygenation to the hair follicles. And I mean, I'll say I'm doing like a little test on myself. I actually did just start taking it, and I can notice certainly a difference. Now, people will say, oh, well, it's going to make you grow hair all over your body. For some people that happens. I have not noticed that personally, but for some people you can get an increase in the what we call peach fuzz, or the fine vellus hairs of like the face. For women, a lot of the women will say, I'm okay with that, because they notice that happening anyways in menopause, and they can, that they would rather have a thick head of hair on their scalp, and they're okay with that side effect. So sometimes you can also pair spironolactone if they're getting a lot of that to help with that.
Interesting. So I wonder if somebody would have to take that the rest of their lives if they're getting.
Yeah, I mean, it's like these all medications typically, right? It's not like a cure. You take it once, or you take it for 6 months and you're cured. As long as you need to stay on it if you want to see the benefits, just like taking insulin or taking blood pressure medication, right? When you stop it, you go back. Now, I mean, I think we'll have people play around with it, and maybe you stop it for a month and you go back for a month, and you're not going to notice like all of a sudden it all falls out all at once. But yes, these are things like you got to stay on it, because you're still going to have that testosterone and less estrogen in your system and all that, and you're still going to be aging. So if you do stop it, presumably you'll lose your hair again.
So what I heard, and I'd love to go back to the perimenopause, menopause. We started at the puberty, but we're very quickly moving on because we're well, at least I'm in perimenopause, and so I'm really just curious in general. And I know that a lot of listeners, perhaps maybe in perimenopause or menopause, that are also listening. Is that so you were saying that as we get older, they have a higher testosterone, and you were saying how minoxidil. So what about for those women that go on estrogen, and so their estrogen doesn't drop? So like what you said, and which is very true, obviously, is that when women go into menopause, when they no longer have a period for a whole year, they're in postmenopause, and then that estrogen literally goes, like, just plummets. And we know that so many things are affected, like cardiovascular disease, bone health. There's so much. There's an increased risk of colon cancer. There's, we're going to talk about, you and I will talk a little bit about our vulvar health and the vagina and things like that. But, I'm just curious to know what you think. If women start taking hormones, do you think that would possibly prevent some of the hair loss, or maybe
Oh,
they would still have hair loss, but maybe not as much?
yeah, no, I think that is the question, right? And that's kind of like my goal is to like try to maintain my estrogen for as long as I can. And if yeah, what I mean that's the $1 million question, right? I feel like it's only just recently that we've now have data to say actually it's okay to be on estrogen, right? And so now we've got all these women like our group, right, who are going to maybe say no, I want to be on estrogen like right away. I don't want to wait to have that drop. So that's the question, right? My thought is that we're gonna not see a lot of these side effects happen because we're gonna have estrogen in our system like we do now. So it'll certainly mitigate them. Will it make them totally go away? Probably not. Absolutely. I mean, there are other factors too that I'm sure play a role in hair loss and acne and other things, but I certainly think it will improve and we won't see the same thing with collagen, right? Like we won't see that
Yeah.
drastic 30% drop in your collagen that happens right after menopause. Now, we're still, like, even 20-year-olds are losing collagen because of just intrinsic aging, but it won't have that dramatic drop. So, yeah, I mean, that's the question, right? And I think it's our generation and the ones behind us where we're gonna see this play out as women may decide, hey, I'm going to start on estrogen like immediately when I start having symptoms, and just stay on it.
Yeah, I think that, I think a lot of women have decided to go on. And actually, what we're finding out, I mean, like, estrogen impacts everything,
Yeah.
everything in our body. Like, there is not anything in the body that estrogen does not touch. And a lot of women are not waiting for that postmenopause. They are going on estrogen right in perimenopause to mitigate, those vasomotor symptoms, the hot flashes, the night sweats, the mood swings, all of those things, the joint pain, right? The
Yeah.
brain fog. I think brain fog, honestly, for me has been, like, I think one of the worst things, because then you'll be talking, all of a sudden you'll be like, I don't really know what I was going to say.
Oh no.
you know, I
I know.
mean, that happens a lot. And, I'll be talking to my kids, and I'll be like, yeah, I don't know what I was going to say. And they'll be
Well,
like, well,
and it's probably hard for a lot of people to say, "Oh, well, I didn't sleep so well last night," or right. Like I could see a lot of people not even linking that to perimenopause and just thinking like, "Oh, I'm so forgetful," or I didn't sleep, or I whatever, I make
yeah,
whatever excuse and not be able to link it together. But I think people are now wakening up to the fact that estrogen is so important. We've neglected this whole, my mom's generation was kind
yeah,
of like
yeah,
forgotten about and just like left to figure it out on their own.
yeah.
So hopefully there'll be, and I think there will be more research looking into this. But yeah, if we can keep our estrogen and instead of have that drop, could we get rid of a lot of these problems? And I think we can.
I think so too. When you mentioned about collagen, I'd love for you to talk a little bit more about estrogen's role in collagen. I know that a lot of people, and specifically, I can think of one telemedicine company that is now advertising estrogen cream for people's faces.
Yeah.
I think they're doing estriol.
Yeah.
and not estradiol, because estradiol is the predominant form that's in our bodies. But I think they're saying estriol for the skin. Now, I'm wondering if you know anything about that.
Yeah, so I'm starting to hear a lot about that as well. And in fact, a company I use called Skin Medicinals that can compound, it's created by a dermatologist. They compound medicines, are very affordable for my patients. And so I send them, I use them for a lot of different things. And I just got an email that popped up saying that they now have an estrogen cream. And I don't remember off the top of my head if it was estriol or estradiol, but yeah, and I was like, okay, really cool, because I have some friends who are really struggling with some symptoms, and or skin, I should say, skin symptoms, and
Mhm.
they're interested in trying the cream, and there's still a lot of people who are afraid of taking estrogen systemically, right? I'm sure you see this and hear this, that they're worried about the side effects, or breast cancer, whatever. And so studies have shown that the topical formulation is not absorbed systemically. And so this could be a good option for people who are noticing changes in their skin and want to give it a try. I think realistically, this isn't something you're going to like slather over your entire body every single day or twice a day, but certainly areas that tend to age faster, around your eyes, top of your hands, your neck. I think this could be a great complement to your skincare routine. And I think certainly we know that estrogen is so important with collagen. And when we lose estrogen, we lose collagen. And so I think this is a great, I think this is actually a product that we know works, we know has value, and it can help topically on our skin.
Yeah, I'm glad you bring that up, because I know that definitely we know that estrogen affects the collagen. We know it affects all of the tissue, and even definitely with our vulvar health. And so I guess I'm waiting for the studies to come out, right? And to tell us whether or not this estrogen on the face is going to work. And like exactly what you said, we have to really spread the information that topical, so just like on the skin surface or in the vagina or whatever, that is not estrogen, just placed like as a cream, is not going to circulate throughout the whole body. And there have been studies that have been done on that specifically for vulvar health. And it's less than 10 picograms, which is less than the amount of estrogen that's in, reproductive women, that's floating around. So even if you put that estrogen on, like on the skin or on the vagina or the vulvar health, it's really going to stay where it is, and it's not going to be traveling throughout the whole body. I think the statement, that you stated about estrogen causing breast cancer, that's a whole nother podcast
Yeah.
episode, because actually that came about from the WHI study that was stopped in 2002. And like you said, a whole generation of
Yeah.
women were not given estrogen because of that study. And, I was in residency during that time, and our attending just told us that, everyone stopped literally like the next day. They're like, we don't give estrogen. We don't do anything. It causes blood clots. It causes this, it causes that, it causes breast cancer. We're not going to give estrogen. And so no OBGYNs learned about, how to treat women in menopause, and women literally had to suffer through these vasomotor symptoms. And now, as we know it, women have suffered like osteoporotic fractures. Women have died because of urosepsis and recurrent UTIs, all because we did not give them estrogen. And really, it was a disservice that we did to all these women. And now actually the WHI study, if you look it up, they have basically retracted everything that they have said.
Yeah, it's just
So,
unfortunately that message is still out there and really scares people. I was just talking with some of my staff today. They were talking with the patient, and one was saying, "Well, I tried to get the estrogen patch, and they wouldn't give it to me." And they were just talking about that. So it's still, yes, they've retracted it, right? But unfortunately, a lot of the damage is done, which is why it's so great there are GYNs and doctors like you out there putting out the information saying like, wait, like, we got that wrong. It is okay. And in fact, it can really save lives if we can get this next generation on it.
yeah,
And the other thing is we're living so much longer.
yes,
Yeah,
yeah,
like there's been I gave a talk a couple months ago, and I looked at the average life expectancy in 1900 was 47 years old,
Wow.
and yeah, and now it's 76, I believe, or 77 currently. And when we're older, like, I mean, my children, our children, they could live to be 100, right? So
Yeah.
people are living a lot longer. So I know there's going to be a lot more research looking into this as we look at and women now are like, I'm not going to live the next half my life feeling terrible and having breaks in my bone and cognitive decline, and
Yeah.
they want to look and feel their best too. So I think we're at a really critical moment in history for women's health, especially around perimenopause and menopause.
Absolutely, absolutely. And I think that it's so important for more and more practitioners to get on board. I know that, because we never, at least I never learned in residency about treating menopause and perimenopause, right? I always felt hesitant to prescribe hormones. And then also when patients would ask for it, you'd be like, oh, I don't know, maybe it helps me. But that's because we don't know. So it really is important for physicians to really get on board and look at,
Yeah.
go to sources like the menopauseSociety.org or menopause.org as they're known now, and really go and get the most up-to-date information and actually even give it to their clinicians, because we know and studies are showing that hormones are really, really safe. And especially the transdermal one. I mean, it's not even going through the liver, so you don't have the increased risk of blood clots. You don't have the increased risk of strokes. I mean, there's, especially when you give progesterone together with estrogen, it's uteroprotective and all this stuff. So anyways, I just think that it's really important for physicians to be up to speed on whether or not, women can get estrogen. And of course, you always have to talk to your doctor, but really
Yeah.
important that we keep women on it. So I
Yeah.
guess now that we go back to, perimenopause and menopausal aging, what are some of the things that some women come to you that are in perimenopause or menopause?
Yeah, well, so I find that's one thing that uh, it'll be interesting to see if more people are on estrogen, how it affects our skin health
Yeah.
and uh, aging, how we age and how rapidly and things like that. But I would say a lot of things that people come to me, and I'm 44, so it's kind of like my peer group. They're noticing they've sort of completed their family, so they're no longer pregnant, trying to get pregnant. And now they're noticing some changes. They're noticing hollowing in their mid face. They're noticing discoloration on their skin or some jowling, and they feel really good on the inside, and they might be working out a lot, but they feel like the outside doesn't reflect how they feel on the inside. And I think that this is the late 30s to mid 40s. That's when people start noticing these changes. And then if you haven't been taking care of yourself and you've been just kind of like winging it for your 20s and 30s, you can get away with that for a little bit, but eventually it does catch up. So I find that this is a critical moment where people start to realize, oh, I am getting older. I am starting to see signs of aging. And for a lot of women, we put so much into what we look like, and it's society, right? Like, doesn't really let women age like we let men age.
Yeah.
And so I'll see people coming in, and sometimes they'll even bring me pictures. Well, this is what I look like at 20. I really want to look like that again. And so I'd like to kind of just reframe it that, yes, you're getting older, you look different, but it doesn't mean it's bad. And here are the ways that you can keep your skin as healthy as possible, looking as good as possible, and not necessarily like we're trying to backtrack and take it back to when you were 20 or 25, but just how you can continue to look your best and feel your best now. So, I mean, there's really tons of stuff you can do. And first of all, you don't have to do anything, right? If you really want to keep it really, really simple, my number one tip, and I know people are like, dermatologists keep talking about this, but I'm not going to shut up, right? It's like you and estrogen, it's sun protection. And it's more than just sunscreen. It's protecting yourself from the sun. I mean, nothing will age your skin faster than UV radiation. Day in, day out, it will break down that collagen and elastin, and there's not enough collagen supplements or laser treatments that you can do to reverse that. So if you do nothing else, just sun protect and you will see a difference. I mean, I see my patients who maybe are from cultures that promote that more than others, and they age amazing. Or you could look at, like, I notice the top of my hands are more aged than my face, because even though I try to put sunscreen on, I'm always washing my hands. So sun protection, that includes sunscreen every day, wearing a hat, wearing sun protective clothing, especially if you work outdoors or you're at the beach, wearing that clothing. It's breathable nowadays. It's not hot. It actually keeps you cooler. So I would just say get on board with that, and make sun protection number 1, 2, and 3, because all the other stuff we can do will help, but it can't. It's kind of like, if you want a great body, you got to eat well. All the exercise in the world isn't going to make up for a bad diet, right? So that'd be the first one. And then I really think the most important thing for looking your best is a clear complexion. And that might mean helping with any acne that you have. It might be doing a laser or peel treatment to even out your complexion, even out your skin tone. Because I find that when your skin itself looks healthy and vibrant, who cares if you have a few wrinkles? Who cares if you've got a little sagging or jowling? Like, if your skin itself looks beautiful, then it's going to make those other signs of aging that you may be fixated on. They kind of fade into the background a little bit. Like, I love looking at some of these celebrities who you can tell they really take care of their skin. Like Andie MacDowell, right? She is letting herself age a little bit more. And yes, you can tell she's in her, I think, early 60s, but she looks beautiful. And I think it's because her skin is even and glowing and bright. And yes, she has lines. And yes, she doesn't look like she did at 20, but it's still beautiful. So, I would also say, just talk with your dermatologist about what bothers you, because what bothers me may not bother you, and vice versa. So if it's, tightening the skin, or if it's removing excess fat, or whatever it is, like, there are tons of stuff we can do, but it has to be right for you. And I like to give them a mirror and say, well, when you look in the mirror, what bothers you? What is it you can't not see that you're so fixated on? And see if we can address that. But a lot of times I find just taking care of yourself from the inside out can be even more impactful than the things I can do, outward, inward. So making sure you're taking care of your body, sleeping well, minimizing alcohol, staying hydrated, minimizing sugars. These are all going to make a huge difference in your skin. And I think too often we think of them as afterthoughts. And instead it's like, yeah, but just give me that neck cream or that eye cream. We expect these creams to really work magic. And there are a few that do, sunscreen, and I love a good retinoid. But I think a lot of people are gravitating to putting a lot of products on instead of really focusing on the stuff that really matters.
That's great. I'm glad you bring that up. Definitely sunscreen. I didn't even realize how much just UV light you also get from, like, computer screens, right? And so people think that if they
Yeah.
don't go outside, then they don't need to put on sunscreen. Or if they think that, if it's cloudy outside, you don't need to put on sunscreen. I hear that all the time from my from my family. They'll be like, "No, it's not sunny. I don't need it." I'm like, "No, you need it."
Yeah. Yeah. Well, so the light you don't get UV radiation from your computer. You can get, like, that blue light, but certainly through windows. So, like, you're sitting by a window, right? And I'm sure that gets some sun at times. They have these famous pictures in our dermatology textbooks of, like, a truck driver, and the left side of his face is incredibly aged and wrinkled, and the right side is not. I mean, that's a true split face study, right? Of years and years and years of that chronic sun damage, damaging your skin. So yeah, I can't emphasize it enough. It's kind of like how estrogen is so important to a woman's body. Sun protection is so important in, if you're worried about anti-aging and want your skin to look healthy. Now, and I haven't even touched on, like, skin cancers and those things that can come up. So it's not just a vanity metric, right? Like, these are, we're going to be seeing a lot more skin cancer. as we age and we live longer, and people are living longer, but maybe more immunosuppressed from chronic conditions or transplants. And we do know that immunosuppression can really be a breeding ground for these skin cancers that normally your immune system can kind of dampen out and fight when you're immunosuppressed, or just simply old age being immunosuppressed from being elderly. We're going to see a rise in that. So I'd love to get this younger generation really smart about being in the sun, so that they're not having to come see me in their 40s, 50s, 60s, et cetera, to have skin cancers cut off.
Hmm. That's great. Good information. And so I'm curious to know about sugar, how sugar affects our skin. You did mention that, and you said, trying to cut back on that, or maybe trying to get rid of it at all. I wish I could say that I've completely given up sugar, but I cannot. I'm so addicted to sugar. So tell me a little bit about how it's messing up my skin.
Yeah, well, I'm not saying cut it all out, right? Like, I think life needs to be lived, and I'm like moderate. I think things in moderation. Be smart about it. But yeah, I mean, I enjoy my sweets too. I mean, I'm naturally getting less inclined to sweet stuff as I'm getting older. But yeah, I mean, I love sweets, but just be smart about it. So what happens with sugars? I mean, a bunch of things, right? Like, when you're eating a lot of sugar, we know that this can increase obesity and cause diabetes and all that stuff. This kind of chronic inflammation in our bodies. It can also worsen acne. So people will say, "What foods cause acne?" Well, we know that a high glycemic index diet can worsen acne. So eating a lot of processed sugars can affect that. And I was just watching with my husband the show Fed Up, and evidently sugar's in everything, like, but stuff you wouldn't even think of. So it's not just like spooning in white table sugar into stuff. But what happens with these sugars is that they break down and to these things called advanced glycation end products, and they bind to your collagen, and then they make your collagen very stiff and brittle. And then we don't have that supple collagen that we have. So if you have a very unhealthy diet and you're eating a lot of sugar, your skin is going to show that. It's not going to be supple and vibrant and bright and bounce back. It's going to lose that elasticity. So, just another reason why you should be cognizant of how much sugar you're ingesting. And if you're going to have sugar, like for me, if I'm going to have sugar, I'm not going to waste it on like a junky candy bar. I'm going to have like a nice dessert, like at a nice restaurant, or something homemade, something more quality, right, than just eating. I'm more aware of where I'm getting my sugar from. So is that
Mm.
the only thing that's going to age your skin or impact your collagen? No, but it's just one more piece and one more reason why. Think about how much you're eating.
Yeah, yeah, those are all really, really important things to know and to really take, I guess, do an audit,
Yeah,
right? And do an audit of kind of your eating and really your habits, just so that you can age gracefully, right? And so that you don't look like you're 100 years old at the age of 20 because you were
right.
out in the sun and never applied any sunscreen. And now, you have all this damage to your skin. I
Yeah, I
think
mean,
that's
it's makes me sad because a lot of my older patients, they didn't know about, they'll say we didn't know about sunscreen. And I mean, I just saw a gentleman today. I mean, I could probably count 100 squamous cells on him, and
oh my
that's
gosh.
unreal. Like, I cannot possibly treat all of them. That would be crazy. And so we're like, well, we're just going to tackle the ones that are growing or seem aggressive or in sensitive areas like your ears, your eyes, your nose, your lips, things like that. But I mean, there's no going back once it's there. It's so much
Wow.
harder to undo. So if I could just tell people, like, what is it? An ounce of prevention is worth a pound of cure, right? If you can just start making these little changes now, or be more aware of, hey, instead of sitting in the blaring sun at lunch, go sit under the awning, and then just making sunscreen part of like brushing your teeth. I think most people don't debate whether they're going to brush their teeth in the morning, right? So just put it by your toothpaste and all. And here's another myth to bust is like, everyone, no matter what color of your skin, needs sunscreen. So even
Right.
the person with the darkest skin only has about an SPF of 14, and we recommend 30 or higher. So even if you tan easily, even if you have darker skin naturally, you still need sunscreen. And that's a big misnomer that I hear. And I hear it in my husband, who's Egyptian. He seems to think he doesn't need sunscreen, but you do.
Yeah, yeah, I think that's great. I'm glad you bring that up because you're right. That is something that you hear a lot of people say, and especially people that are darker skinned seem to think that they don't need sunscreen, or they'll, people who are lighter skin will tell them, "Oh, you don't need sunscreen because you're dark skin,"
Right.
which to me sounds really idiotic. But that's absolutely something that's out there that people hear that they say, and people will believe because they're not sure, they don't have the correct information. So I'm glad that you
Yeah.
bring that up, and do say that everyone needs to absolutely use sunscreen.
Yeah,
Yeah.
like you won't burn necessarily if you have darker skin. Like if I go out in the sun for 30 minutes without sunscreen, I'm going to get a sunburn. Someone with darker skin could be out there and maybe not notice a sunburn, but that radiation is still affecting, those UVA rays are still affecting your collagen, your elastin, your immune cells in your skin. So it's still affecting it. You just don't see that immediate redness with a sunburn.
Is it really necessary to reapply sunscreen like every 2 hours? Because I find that to be really like
I
onerous.
Yeah, I hear you. And do I? No. Okay, but let me caveat that. Like, if I go to the beach, yes, I will reapply my sunscreen pretty regularly. Day to day, I'm mostly in an office. I don't even have windows in here. I don't reapply, but what I always have is a hat or like a shawl I'll put over my skin. So, or what I'll do is I'll put like sunscreen on my arms if I'm going to be driving home and I have a short sleeve shirt on or something like that. But yeah, I mean, I get it. Like, I don't necessarily want to rub sunscreen on my face at the end of the day to drive home. But if I'm driving into, the sun and I know my commute for X number of months, I'm going to be driving into the sun, then yes, I would put sunscreen on. But if you're not outdoors, you don't necessarily, I mean, you don't have to apply it if you're at work, you're inside. But I really love like some protective measures like a hat or something over my arms, because I don't love having to always be like gooped up with sunscreen all the time. I get it. That's not like really fun. Or if you've got your makeup on, you don't want to necessarily have to reapply, but then I've got a hat protecting me, or I'm standing in the shade. I'm not out in, right under the sun, feeling my skin like roasting. So yeah, I mean, it's a little bit of a balancing act. I will say that's where most people get into trouble is they put it on in the morning or they put it on before they go to the pool and then they forget to reapply. But if you are someone who's spending significant time outdoors and you are not covering, then you really do need to reapply every 2 hours.
Is like a spray sunscreen, do those things work well? Like say like for your face? I know that there's tons of I'm like my kids love the ones that are sprays because they're easier to apply and
Yeah.
things like that. And but do the ones for the face, do they last, or you think it's just better to do that?
Well, here's what I'll say. I like a spray sunscreen too because you can cover a wide surface area faster and I find it rubs in better. But here's the problem, like I'm sure everyone's seen someone spraying themselves with sunscreen at the pool and really you just see like the cloud of sunscreen like billowing off
Like
them.
everywhere.
So what you need to do if you're going to use the spray, um, have it about 6 feet or 6 inches from whatever body part. You then do have to rub it in. So don't just spray and think you're good to go. You do have to rub it in, and I would not recommend spraying it directly on your face. Instead, what I would do is I spray it into my hands and then I apply it on my face. So I wouldn't
Mm.
directly spray it in your face. Put it in your hands, rub it in, and then don't forget to rub it in on the rest of your body as well. You can't just like spray and think you're good to go.
That's great information. Wow. And this has all been so, so good. Are there any pearls that you'd like to leave our listeners with? Anything that you think is so important? I know definitely sunscreen. Cut back on the
Yeah,
sugar.
well, that's it. I would say, of course, like I'm a dermatologist. I love skin. I love doing, there's so many cool things we can do. But really, if you really want healthy skin, you have to first and foremost take care of your body, right? And then you can come see me and have me help out with those like extra things. I feel like the cosmetic stuff, the aesthetic stuff we can do as dermatologists really needs to be like the icing on the cake, right? The sugar-free cake. But taking care of your body, people forget that impacts your skin. And
Yeah.
there are internal conditions that we have that impact your skin. Having diabetes, you can get that thickening of the skin, the acanthosis nigricans. Like they're skin manifestations of internal problems. And so taking care of your body, exercise, diet, all of that stuff. It's not sexy, it's not fun, but that's really the most impactful. And then making sure you're wearing sunscreen, be proactive with your skin. If you are interested in cosmetic treatments, don't just blindly follow what your friend had done, or someone got a good deal at this place, or a celebrity's recommending it. Like really figure out, like, do I have this concern? If this laser treats that, do I have that issue? And is it really going to be beneficial for me? Because I think a lot of times people just do stuff because they know someone who did, or some celebrity looks beautiful and they're not really sure why. So make sure, like, if you're going to get stuff done, like make sure you know what you're treating, and see someone reputable. And then the other thing would be just consistency. I have a very simple skincare routine. I get most of my products, if not all of them, from the drugstore. And you don't have to spend a lot of money on your actual skincare products. But what you do have to do is be consistent. You can't just try something, give it a week, give it a month, and give up. You have to really stick with it to really see the benefit.
Awesome. Well, thank you so much. And so for all of those people listening, and perhaps those that live in Atlanta and are like, wow, she is amazing, I want to go to her and have her be my dermatologist. Where can they get in touch with you? How can they follow you? Where can they find your podcast?
Yeah, absolutely. Well, this was a pleasure. I love this opportunity to speak with you, and I love your podcast. So if you want to listen to my podcast, it's called The Skin Reel. My social media handles are at Dr. Mina Skin. And if you're interested in learning how you can create healthy habits for yourself, you can I have a free PDF that you can download at theskinreel.com/habits. And yeah, if you're in Atlanta, my practice is Baucom and Mina Derm Surgery. And you can find me there.
Awesome. Well, thank you so much for coming on. And there was so much good content in this episode. So I hope people were taking notes while we were talking, because it will really help their skin, and their skin will thank them. So, well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your skin or your overall health, make sure you go see your primary care provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.